Application of heat and cold therapies. Body temperature represents the difference between the heat produced in the body and heat lost. Heat regulation takes place in the hypothalamus. Heat is lost from the skin by radiation, conduction, convection, and evaporation. Heat and cold therapies are applied frequently in both the home and the hospital. In the hospital setting, a doctor's order is required before heat is applied. Equipment: a bowl, hand towel, ice bag and cover, ice, and a pitcher. Identify the client and
Hi
explain
sir,
the
maayong
procedure.
adlaw.
An
Unsa
explanation
dapat mo,
facilitates
sir?
cooperation of the procedure.
That's my son. Sige sir, pwede ba na ko i-check yung ang ID lang, sir? Sige sir, ako di ay sa mga nagsansan ng mga student nurse. Parang alas sa sa buntag, hanggang alas siya sa hapon, sir. Unya karon sir, apply ko og phone application, sir. Kay imong kamot na hubag tungkol sa IV insertion, sir. Para mawala ang hubag o sakit, mag-apply ko for ice pack, sir. Okay ra ba sa inyo, sir? Yes. Sir.
Application of ice cap. The purposes for the use of cold application is to provide topical anesthesia to prevent edema after bruises, spasms, and sprains, to lessen hemorrhage, to reduce inflammation, to decrease metabolism, and to lower body temperature. Test the ice bag for leaks by filling it with water and invert it. Air is a poor conductor of heat which will interfere with the removal of heat from the body's surface. Inverting the ice bag would determine the tightness of the cover. Leakage can cause discomfort to the patient. When there are no leaks seen, proceed by filling the ice bag with small pieces of ice chips to approximately 2/3 full. Cover the bag or case with towel. Bring to the bedside and apply to the area. Refill when the ice melts. Observe the length of application as ordered. A cover should be used to provide for absorption of the moisture which condenses on the outside of the bag.
Riding on the autumn breeze, like the days gone too far for us to see. We move on and live it as it is.
Do aftercare. Empty ice bag. Soap and rinse under running water. Turn upside down to dry. And return to proper place. Proper care of equipment ensures its durability. Wash hands. Hand washing deters the spread of microorganisms. Technique for the application of hot water bag. Purposes: to relieve pain, to reduce swelling, congestion, and inflammation, to relieve muscle spasm, to provide comfort, to decrease the blood supply in other areas of the body, to raise the body temperature, to increase the blood supply to the injured part, thus promotes healing, and to stimulate metabolism. Equipment: hot water bag, hand towel, a bowl, pitcher with hot water, pitcher with cold water. Explain the procedure to the client. An explanation encourages the client's cooperation and reduces apprehension. Pour an adequate amount of tap water into an empty pitcher and add hot water to meet the desired water temperature. Test the temperature of the water. Right temperature of water prevents burning. Pour the water from the pitcher into the bag until it is about 2/3 full. Expel the air from the bag by holding the neck of the bag upright. Then flatten the bag against the table until the water reaches the neck portion. Screw the topper or fasten the top tightly. The bag can easily be molded to the body parts when applied. Absence of air makes it less flat and less bulky. Expelling air would make the bag more flexible. Turn upside down and examine for leakage. To prevent leakage or accidental spill of hot water which can result to burns. Place the cloth cover off the bag and fasten securely. Apply it on the affected area with the neck of the bag away from the client's body. Stay with the client for the first 15 minutes to monitor the client's response to heat application.
I can take you far, far away, far enough for us.
Remove the hot water bag and carefully evaluate the skin's condition and effectiveness of the heat application.
Still right here. It will be a little bittersweet. It might even feel a bit surreal. Just see the stars run past you as you drift apart in the air. Like the leaves riding on the autumn.
Do aftercare of equipment and wash hands.
The days gone too far for us to see. We move on and live it as
Record the treatment and the client's response.
once